Fundamental of Nursing Chapter 19 Implementing Nursing Care, which action indicates the nurse is using a PICOT question to improve care for a patient? A. Practices nursing based on the evidence presented in court. B. Implements interventions based on scientific research. C. Uses standardized care plans for all patients. D. Plans care based on tradition. Answer B. Implements interventions based on scientific research. The best answer is implementing interventions based on scientific research. Using results of a literature search to a PICOT question can help a nurse decide which interventions to use. Practicing based on evidence presented in court is incorrect. Practice is based on current research. Using standardized care plans may be one example of evidence-based practice, but it is not used on all patients. The nurse must be careful in using standardized care plans to ensure that each patient's plan of care is still individualized. Planning care based on tradition is incorrect because nursing care should be based on current research. The nurse decides to administer a tablet of Tylenol instead of the intramuscular Demeral. She has previously been providing her orthopedic client. Which step of nursing process does this address? A. Assessment. B. Nursing diagnosis. C. Planning. D. Implementation. Answer D. Implementation. Whenever nursing is performing an action. ADPID assessment is gathering information. Physical assessment or get information from MBR's chart. Ask questions from patient or family member. A nurse is developing a care plan. Which intervention is most appropriate for the nursing diagnostic statement? Risk for loneliness related to impaired verbal communication. A. Provide the patient with a writing board each shift. B. Obtain an interpreter for the patient as soon as possible. C. Assist the patient in performing swallowing exercises each shift. D. Ask the family to provide a sitter to remain with the patient at all times. Answer: provide the patient with a writing board each shift. Choose interventions to alter the etiological related to factor or causes of the diagnosis. If the etiology is impaired verbal communication, then the nurse should choose an intervention that will address the problem. Providing the patient with a writing board will allow the patient to communicate by writing because the patient is unable to communicate verbally at this time. Obtaining an interpreter might be an appropriate intervention if the patient spoke a foreign language. Assisting with swallowing exercises will help the patient with swallowing, which is a different etiology than impaired verbal communication. Asking the family to provide a sitter at all times is many times unrealistic and does not relate to the impaired verbal communication. The goal would relate to the loneliness. The nurse is teaching a new nurse about protocols. Which information from the new nurse indicates a correct understanding of the teaching? A. Protocols or guidelines to follow that replace the nursing care plan. B. Protocols assist the clinician in making decisions and choosing interventions for specific healthcare problems or conditions. C. Protocols or policies designating each nurse's duty according to standards of care and a code of ethics. D. Protocols are prescriptive order forms that help individualize the plan of care. Answer: B. Protocols assist the clinician in making decisions and choosing interventions for specific healthcare problems or conditions. A clinical practice guideline or protocol is a systematically developed set of statements that helps nurses, physicians, and other healthcare providers make decisions about appropriate health care for specific clinical situations. This guideline establishes interventions for specific healthcare problems or conditions. The protocol does not replace the nursing care plan. Evidence-based guidelines from protocols can be incorporated into an individualized plan of care. A clinical guideline is not the same as a hospital policy. Standing orders contain orders for the care of a specific group of patients. A protocol is not a prescriptive order form like a standing order. A nurse is completing a care plan. Which intervention is most appropriate for the nursing diagnostic statement impaired skin integrity related to shearing forces? A. Administer pain medication every 4 hours as needed. B. Turn the patient every 2 hours, even hours. C. Monitor vital signs, especially rhythm. D. Keep the bedside rails up at all times. Answer B. Turn the patient every 2 hours, even hours. The most appropriate intervention for the diagnosis of impaired skin integrity is to turn the patient. Choose interventions to alter the etiological related factor or causes of the diagnosis. The other options do not directly address the shearing forces. The patient may need pain medication, but acute pain would be another nursing diagnosis. Monitoring vital signs does not have when or how often these should be done. Keeping the side rails up addresses safety, not skin integrity. A patient has reduced muscle strength following a left-sided stroke and is at risk for falling. Which intervention is most appropriate for the nursing diagnostic statement risk for falls? A. Keep all side rails down at all times. B. Encourage patient to remain in bed most of the shift. C. Place patient in room away from the nurse's station if possible. D. Assist patient into and out of bed every 4 hours or as tolerated. Answer D. Assist patient into and out of bed every 4 hours or as tolerated. Risk for falls is a risk potential nursing diagnosis, therefore. The nurse needs to implement actions that will prevent a fall. Assisting the patient into and out of bed is the most appropriate intervention to prevent the patient from falling. Encouraging activity builds muscle strength and helping the patient with transfers ensures patient safety. Encouraging the patient to stay in bed will not promote muscle strength. Decreased muscle strength is the risk factor placing the patient in jeopardy of falling. The side rails should be up, not down, according to agency policy. This will remind the patient to ask for help to get up and will keep the patient from rolling out of bed. The patient should be placed near the nurse's station, so a staff member can quickly get to the room and assist the patient if necessary. The standing orders for a patient include acetaminophen 650 mg every 4 hours PRN for headache. After assessing the patient, the nurse identifies the need for headache relief and determines that the patient has not had acetaminophen in the past 4 hours. Which action will the nurse take next? A. Administer the acetaminophen. B. Notify the health care provider to obtain a verbal order. C. Direct the nursing assistive personnel to give the acetaminophen. D. Perform a pain assessment only after administering the acetaminophen. Answer A. Administer the acetaminophen. A standing order is a pre-printed document containing orders for the conduct of routine therapies, monitoring guidelines, and/or diagnostic procedures for specific patients with identified clinical problems. The nurse will administer the medication. Notifying the health care provider is not necessary if a standing order exists. The nursing assistive personnel are not licensed to administer medications, therefore. Medication administration should not be delegated to this person. A pain assessment should be performed before and after pain medication administration to assess the need for and effectiveness of the medication. Which action indicates a nurse is using critical thinking for implementation of nursing care to patients? A. Determines whether an intervention is correct and appropriate for the given situation. B. Reads over the steps and performs a procedure despite lack of clinical competency. C. Establishes goals for a particular patient without assessment. D. Evaluates the effectiveness of interventions. Answer A. Determines whether an intervention is correct and appropriate for the given situation as you implement interventions. Use critical thinking to confirm whether the interventions are correct and still appropriate for a patient's clinical situation. You are responsible for having the necessary knowledge and clinical competency to perform interventions for your patients safely and effectively. The nurse needs to recognize the safety hazards of performing an intervention without clinical competency and seek assistance from another nurse. The nurse cannot evaluate interventions until they are implemented. Patients need ongoing assessment before establishing goals because patient conditions can change very rapidly. A nurse is reviewing a patient's care plan. Which information will the nurse identify as a nursing intervention? A. The patient will ambulate in the hallway twice this shift using crutches correctly. B. Impaired physical mobility related to inability to bear weight on right leg. C. Provide assistance while the patient walks in the hallway twice this shift with crutches. D. The patient is unable to bear weight on right lower extremity. Answer. C. Provide assistance while the patient walks in the hallway twice this shift with crutches. Providing assistance to a patient who is ambulating is a nursing intervention. The statement, "The patient will ambulate in the hallway twice this shift using crutches correctly," is a patient outcome. Impaired physical mobility is a nursing diagnosis. The statement that the patient is unable to bear weight and ambulate can be included with assessment data and is a defining characteristic for the diagnosis of impaired physical mobility. A patient recovering from a leg fracture after a fall reports having dull pain in the affected leg and rates it as a 7 on a 0 to 10 scale. The patient is not able to walk around in the room with crutches because of leg discomfort. Which nursing intervention is priority? A. Assist the patient to walk in the room with crutches. B. Obtain a walker for the patient. C. Consult physical therapy. D. Administer pain medication. Answer D. Administer pain medication. The patient's pain is a 7, indicating the priority is pain relief. Administer pain medication. Acute pain is the priority because the nurse can address the problem of immobility after the patient receives adequate pain relief. Assisting the patient to walk or obtaining a walker will not address the pain the patient is experiencing. A nurse is providing nursing care to patients after completing a care plan from nursing diagnoses. In which step of the nursing process is the nurse? A. Assessment. B. Planning. C. Implementation. D. Evaluation. Answer. C. Implementation. Implementation. The fourth step of the nursing process formally begins after a nurse develops a plan of care, with a care plan based on clear and relevant nursing diagnoses. A nurse initiates interventions that are designed to assist the patient in achieving the goals and expected outcomes needed to support or improve the patient's health status. The nurse gathers data during the assessment phase and mutually sets goals and prioritizes care during the planning phase. During the evaluation phase, the nurse determines the achievement of goals and effectiveness of interventions. Priorities are established to help the nurse anticipate and sequence nursing interventions when a client has multiple problems or alterations. Priorities are determined by the client's A. Physician B. Non-emergent, non-life-threatening needs C. Future well-being D. Urgency of problems. Answer D. Urgency of problems. The nurse is caring for a patient who requires a complex dressing change. While in the patient's room, the nurse decides to change the dressing. Which action will the nurse take just before changing the dressing? A. Gathers and organizes needed supplies. B. Decides on goals and outcomes for the patient. C. Assesses the patient's readiness for the procedure. D. Calls for assistance from another nursing staff member. Answer: C. Assesses the patient's readiness for the procedure. Always be sure a patient is physically and psychologically ready for any interventions or procedures. After determining the patient's readiness for the dressing change, the nurse gathers needed supplies. The nurse establishes goals and outcomes before intervening. The nurse needs to ask another staff member to help if necessary. After determining readiness of the patient, a patient visiting with family members in the waiting area tells the nurse, "I don't feel good, especially in the stomach." What should the nurse do? A. Request that the family leave so the patient can rest. B. Ask the patient to return to the room so the nurse can inspect the abdomen. C. Ask the patient when the last bowel movement was and to lie down on the sofa. D. Tell the patient that the dinner tray will be ready in 15 minutes and that may help the stomach feel better. Answer: B. Ask the patient to return to the room so the nurse can inspect the abdomen. In this case, the environment needs to be conducive to completing a thorough assessment. A patient's care environment needs to be safe and conducive to implementing therapies. When you need to expose a patient's body parts, do so privately by closing room doors or curtains because the patient will then be more relaxed. The patient needs to return to the room for an abdominal assessment for privacy and comfort. The family can remain in the waiting area while the nurse assists the patient back to the room. Beginning the assessment in the waiting area, lie down on the sofa in the presence of family and other visitors does not promote privacy and patient comfort. Telling the patient that the dinner tray is almost ready is making an assumption that the abdominal discomfort is due to not eating. The nurse needs to perform an assessment first. A newly admitted patient who is morbidly obese asks the nurse for assistance to the bathroom for the first time. Which action should the nurse take initially? A. Ask for at least 2 other assistive personnel to come to the room. B. Medicate the patient to alleviate discomfort while ambulating. C. Review the patient's activity orders. D. Offer the patient a walker. Answer: C. Review the patient's activity orders. Before beginning care, review the plan to determine the need for assistance and the type required. Before intervening, the nurse must check the patient's orders. For example, if the patient is on bed rest, the nurse will need to explain the use of a bedpan rather than helping the patient get out of bed to go to the bathroom. Asking for assistive personnel is appropriate after making sure the patient can get out of bed. If the patient is obese, the nurse will likely need assistance in getting the patient to the bathroom. Medicating the patient before checking the orders is not advised in this situation. Before medicating for pain, the nurse needs to perform a pain assessment. Offering the patient a walker is a premature intervention until the orders are verified. A new nurse is working in a unit that uses interdisciplinary collaboration. Which action will the nurse take? A. Act as a leader of the healthcare team. B. Develop good communication skills. C. Work solely with nurses. D. Avoid conflict. Answer: B. Develop good communication skills. Good communication between other healthcare providers builds trust and is related to the acceptance of your role in the healthcare team. As a beginning nurse, you will not be considered a leader of the healthcare team, but your input as an interdisciplinary team member is critical. Interdisciplinary involves other healthcare providers, not just nurses. Organizational culture includes leadership, communication processes, shared beliefs about the quality of clinical guidelines, and conflict resolution. As goals, outcomes, and interventions are developed, the nurse must A. Be in charge of all care and planning for the client. B. Be aware of and committed to accepted standards of practice from nursing and other disciples. C. Not change the plan of care for the client. D. Be in control of all interventions for the client. Answer B. Be aware of and committed to accepted standards of practice from nursing and other disciples. Which action should the nurse take first during the initial phase of implementation? A. Determine patient outcomes and goals. B. Prioritize patient's nursing diagnoses. C. Evaluate interventions. D. Reassess the patient. Answer D. Reassess the patient. Assessment is a continuous process that occurs each time the nurse interacts with a patient. During the initial phase of implementation, reassess the patient. Determining the patient's goals and prioritizing diagnoses take place in the planning phase before choosing interventions. Evaluation is the last step of the nursing process. Vital signs for a patient reveal a high blood pressure of 187/100ths. Orders state to notify the healthcare provider for diastolic blood pressure greater than 90. What is the nurse's first action? A. Follow the clinical protocol for a stroke. B. Review the most recent lab results for the patient's potassium level. C. Assess the patient for other symptoms or problems, and then notify the healthcare provider. D. Administer an antihypertensive medication from the stock supply, and then notify the healthcare provider. Answer: C. Assess the patient for other symptoms or problems, and then notify the healthcare provider. Communication to other healthcare professionals must be timely, accurate, and relevant to a patient's clinical situation. The best answer is to reassess the patient for other symptoms or problems and then notify the healthcare provider according to the orders. Reviewing the potassium level does not address the problem of high blood pressure. The nurse does not follow the protocol since the order says to notify the healthcare provider. The orders read to notify the healthcare provider, not administer medications. Which initial intervention is most appropriate for a patient who has a new onset of chest pain? A. Reassess the patient. B. Notify the healthcare provider. C. Administer a PRN medication for pain. D. Call radiology for a portable chest X-ray. Answer A. Reassess the patient. Preparation for implementation ensures efficient, safe, and effective nursing care. The first activity is reassessment. The cause of the patient's chest pain is unknown, so the patient needs to be reassessed before pain medication is administered or a chest X-ray is obtained. The nurse then notifies the patient's healthcare provider of the patient's current condition in anticipation of receiving further orders. The patient's chest pain could be due to muscular injury or pulmonary issue. The nurse needs to reassess first. To initiate an intervention, the nurse must be competent in 3 areas, which include A. Knowledge, function, and specific skills. B. Experience, advanced education, and skills. C. Skills, finances, and leadership. D. Leadership, autonomy, and skills. Answer A. Knowledge, function, and specific skills. A nurse is making initial rounds on patients. Which intervention for a patient with poor wound healing should the nurse perform first? A. Reinforce the wound dressing as needed with 4 times 4 gauze. B. Perform the order dressing change twice daily. C. Observe wound appearance and edges. D. Document wound characteristics. Answer C. Observe wound appearance and edges. The most appropriate initial intervention is to assess the wound. Observe wound appearance and edges. The nurse must assess the wound first before the findings can be documented. Reinforcement of the dressing and the actual skill of dressing changes. The nurse establishes trust and talks with a school-aged patient before administering an injection. Which type of implementation skill is the nurse using? A. Cognitive. B. Interpersonal. C. Psychomotor. D. Judgmental. Answer B. Interpersonal nursing practice includes cognitive, interpersonal, and psychomotor skills. Interpersonal skills involve developing trusting relationships with patients, conveying caring and compassion, and communicating clearly. Cognitive skills include critical thinking and decision-making skills. Psychomotor skill requires the integration of cognitive and motor abilities, such as administering the injection. Being judgmental is not appropriate in nursing. Nurses are non-judgmental. The nurse inserts an intravenous IV catheter using the correct technique and following the recommended steps according to standards of care and hospital policy. Which type of implementation skill is the nurse using? A. Cognitive. B. Interpersonal. C. Psychomotor. D. Judgmental. Answer C. Psychomotor nursing practice includes cognitive, interpersonal, and psychomotor skills. Psychomotor skill requires the integration of cognitive and motor abilities. The nurse in this example displayed the psychomotor skill of inserting an intravenous catheter while following standards of care and integrating knowledge of anatomy and physiology. Cognitive involves the application of critical thinking and use of good judgment in making sound clinical decisions. Interpersonal skills involve developing trusting relationships with patients, conveying caring and compassion, and communicating clearly. A staff development nurse is providing an in-service for other nurses to educate them about the nursing interventions classification (NIC) system. During the in-service, Which statement made by one of the nurses in the room requires the staff development nurse to clarify the information provided? A. This system can help medical students determine the cost of the care they provide to patients. B. If the nursing department uses this system, communication among nurses who work throughout the hospital may be enhanced. C. We could use this system to help organize orientation for new nursing employees because we can better explain the nursing interventions we use most frequently on a run. D. The NIC system provides one way to improve safe and effective documentation in the hospital's electronic health record. Answer A. This system can help medical students determine the cost of the care they provide to patients. NIC does not help determine the cost of services provided by nurses. The staff development nurse would need to correct this misconception. Because this system is specific to nursing practice, it would not help medical students determine the costs of care. The NIC system developed by the University of Iowa differentiates nursing practice from that of other healthcare disciplines. All the other statements are true. Benefits of using NIC include enhancing communication among nursing staff and documentation, especially within health information systems such as an electronic documentation system. NIC also helps nurses identify the nursing interventions they implement most frequently. Units that identify routine nursing interventions can use this information to develop checklists for orientation. Mr. Bagley is placed on isolation precautions. Isolation precautions as a treatment intervention are an example of which type of care? A. Direct. B. Indirect. C. Prevention. D. Safety. Answer B. Indirect. Act on behalf of patient. The nurse is intervening for a family member with role strain. Which direct care nursing intervention is most appropriate? A. Assisting with activities of daily living. B. Counseling about respite care options. C. Teaching range of motion exercises. D. Consulting with a social worker. Answer B. Counseling about respite care options. Family caregivers need assistance in adjusting to the physical and emotional demands of caregiving. Sometimes they need respite, i.e., a break from providing care. Counseling is an example of a direct care nursing intervention. The other options do not address the identified problem of role strain, activities of daily living, and range of motion exercises. Consulting is an indirect care nursing intervention. The nurse is intervening for a patient that has a risk for a urinary infection. Which direct care nursing intervention is most appropriate? A. Teaches proper hand washing technique. B. Properly cleans the patient's toilet. C. Transports urine specimen to the lab. D. Informs the oncoming nurse during handoff. Answer A. Teaches proper hand washing technique. Teaching proper hand washing technique is a direct care nursing intervention. All the rest are indirect nursing care: cleaning the toilet, transporting specimens, and performing handoff reports. The nurse is revising the care plan. In which order will the nurse perform the tasks, beginning with the first step? 1. Revise specific interventions. 2. Revise the assessment column. 3. Choose the evaluation method. 4. Delete irrelevant nursing diagnoses. Answer a 2, 4, 1, 3. Modification of an existing written care plan includes 4 steps. 1. Revise data in the assessment column to reflect the patient's current status. update any new data to inform other members of the healthcare team of the time that the change occurred. 2. Revise the nursing diagnoses. Delete nursing diagnoses that are no longer relevant and add and date any new diagnoses. Revise related factors in the patient's goals, outcomes, and priorities. Date any revisions. 3. Revise specific interventions that correspond to the new nursing diagnoses and goals. Be sure that revisions reflect the patient's present status. 4. Choose the method of evaluation for determining whether you achieved patient outcomes. Which of the following is the first nursing intervention that is appropriate when an IV infusion infiltrates? A. Discontinue the IV infusion. B. Elevate the site of infusion. C. Attempt to flush the tube. D. Apply warm and moist compress. Answer. A. Discontinue the IV infusion. Nurse-initiated interventions are A. Determined by State Nurse Practice Acts. B. Supervised by the entire healthcare team. C. Made in concert with the plan of care initiated by the physician. D. Developed after interventions for the recent medical diagnoses are evaluated. Answer. A. Determined by State Nurse Practice Acts. Individual Nurse Practice Acts determine nurse-initiated interventions. You are writing a care plan for a newly admitted patient. Which one of these outcome statements is written correctly? A. The patient will eat 80% of all meals. B. The nursing assistant will set the patient up for a bath every day. C. The patient will have improved airway clearance by June 5th. D. The patient will identify the need to increase dietary intake of fiber by June 5th. Answer. D. The patient will identify the need to increase dietary intake of fiber by June 5th. Keyword identity outcome statement should have measurable and realistic goals. This case. The goal is both measurable, will identify the need to increase dietary intake by June 5th, and realistic. A nurse is providing nursing care to a group of patients. Which actions are direct care interventions? Select all that apply. A. Ambulating a patient. B. Inserting a feeding tube. C. Performing resuscitation. D. Documenting wound care. Teaching about medications. Answer. A, B, C, and EA. Ambulating a patient. B. Inserting a feeding tube. C. Performing resuscitation. E. Teaching about medications. All of the interventions listed ambulating, inserting a feeding tube, performing resuscitation, and teaching are direct care interventions involving patient and nurse interaction, except documenting wound care. Documenting wound care is an example of an indirect intervention. A nurse is preparing to carry out interventions. Which resources will the nurse make sure are available? Select all that apply. A. Equipment. B. Safe environment. C. Confidence. D. Assistive personnel. E. Creativity. Answer. A, B, and D. A. Equipment. B. safe environment. D. Assistive personnel. A nurse will organize time and resources in preparation for implementing nursing care. Most nursing procedures require some equipment or supplies. Before performing an intervention, decide which supplies you need and determine their availability. Patient care staff, assistive personnel, work together as patient's needs demand it. A patient's care environment needs to be safe and conducive to implementing therapies. Confidence and creativity are needed to provide safe and effective patient care. However, these are critical thinking attitudes, not resources. A nurse is implementing interventions for a group of patients. Which actions are nursing interventions? Select all that apply. A. Order chest X-ray for suspected arm fracture. B. Prescribe antibiotics for a wound infection. C. Reposition a patient who is on bed rest. D. Teach a patient preoperative exercises. E. Transfer a patient to another hospital unit. C. Reposition a patient who is on bed rest. D. Teach a patient preoperative exercises. E. Transfer a patient to another hospital unit. Answer: C, D. E. A nursing intervention is any treatment based on clinical judgment and knowledge that a nurse performs to enhance patient outcomes. Repositioning, teaching, and transferring a patient are examples of nursing interventions. Ordering a chest X-ray and prescribing antibiotics are examples of medical interventions performed by a health care provider. Which interventions are appropriate for a patient with diabetes and poor wound healing? Select all that apply. A. Perform dressing changes twice a day as ordered. B. Teach the patient about signs and symptoms of infection. C. Instruct the family about how to perform dressing changes. D. Gently refocus patient from discussing body image changes. E. Administer medications to control the patient's blood sugar as ordered. Answer: A, B, C, and E. A. Perform dressing changes twice a day as ordered. B. Teach the patient about signs and symptoms of infection. C. Instruct the family about how to perform dressing changes. E. Administer medications to control the patient's blood sugar as ordered. Nursing priorities include interventions directed at enhancing wound healing. Teaching the patient about signs and symptoms of infection will help the patient identify signs of appropriate wound healing and know when the need for calling the health care provider arises. Performing dressing changes, controlling blood sugars through administration of medications, and instructing the family in dressing changes all contribute to wound healing. As long as a patient is stable and alert, it is appropriate to allow family to assist with care. The patient should be allowed to discuss body image changes.